Okay,
Hello,
welcome
everyone.
everyone. Just getting everybody loaded in here. I see some familiar faces already. We've got people trickling in.
Oh, so many pages of humans. Wah, wah.
Okay. All right. Well, our recording started. Thank you so much, Gaila Kiesla, and good morning to everyone. Thank you for joining us for this Early Bird UNU Lab webinar. I'm so grateful to welcome in two extraordinary folks, just brilliant minds and allies in the fight against Indigenous-specific racism in healthcare. In this learning series webinar, we're really celebrating and giving some room to learn about some practical tools and ways of being in this work that are very effective, that's time tested on all different levels, and just really wanting to raise my hands to the good work at the UNU lab for doing ISAR work great and small, like through research and through hiring practices and all the things that here at PHSA that we're striving to do. So what a better perfect union to come together and have this meeting and to discuss what can we do in our action plans, in our strategic plans, in our communities of practice to help move this forward. So I want to, I'm going to turn the microphone over to my co-facilitator, Alicia Frickton, who's going to do some intros. Gaila Kessler.
Thanks, Gayustis, and welcome everybody. My name is Alicia. I'm a white settler of Ashkenazi Jewish Eastern European ancestry, and I live here on beautiful, unceded, and occupied Musqueam, Squamish, and Tsleil-Waututh homelands in Vancouver. I'm delighted to also welcome you this morning. I want to welcome all 121 of you this morning, so we've got a good-sized group. I'm just going to start us off just with a little bit of a Teams orientation and a test. So you see at the top of your screen, you got the little raised hand feature. It looks like this. Okay. If you are familiar and have seen some or have used in any way Dr. Danièle and Dr. Kate's work, please go ahead and raise your hand like this so we can just get a sense of how many people are familiar with their work. And let's just take a look here. Oh, wow. Okay, so we've got at least 27, 28, 29, at least 29, 30. Okay, so we can see the number kind of going up there a little bit. So it's a good size group. About a third of the people who've used your work before, Danièle and Kate, and maybe some new people as well. So thanks so much. You can go ahead and put your hands down. So I will, before I officially turn it over to Kate and Danièle, I just want to let everybody know what it is that we're doing today, because we do have about 2 hours together. So our plan is to finish at 9 o'clock. You will see that this meeting is being recorded. And there is, and I'll tell you how you can communicate with us both during and after. We're going to have a question period after Kate and Danièle are finished talking. So at the top of your screen, you'll see there is an icon that says chat. And if you click it, you'll open a chat where you can put some comments in there. So I'm going to invite everyone just to put in a comment where you're calling from, whose land you're on. You can introduce yourself, who you are, where you're calling from. If you like, you could say maybe your favorite tool or piece of research that Danièle and Kate have worked on. So please go ahead and pop that in the chat, and then you'll get a chance to see everybody else who's on here. And that chat will be a place for you to go ahead and communicate with each other. And yes, I think the chat has been turned on, but I don't see anybody writing anything in there. So please go ahead and maybe Gayustis or Fiona, you want to put yourselves in the chat just so people can see it. Perfect. Thanks, Catherine. Okay, so there you can see the chat over there. Now up at the top of the screen, you also see an icon that says Q&A. So if you click on this Q&A, there'll be a place in there where you can start a discussion, and basically you could just ask a question and then you can vote on other questions in there. And when we get to the Q&A, we'll use that to bring some questions forward to Kate and Danièle. And of course, we're open to taking your questions another way. We'll see how it goes when we get to the time. Maybe some people will have other ways that they want to participate, but that Q&A will get us started off. So I think that's all the housekeeping I have for you. I'm excited to introduce you to both Danièle and Kate. And if you were wondering, in case what the UNU lab stands for, which I was as well, that's Unlearning and Undoing. And they have an Unlearning and Undoing White Supremacy and Indigenous-Specific Racism lab in population and public health. This is at PHSA in the BC Centre for Disease Control. Started in January 2024, and I am told that there is no end date because they are committed to continuing to do the work until racism has gone. So we look forward to working with them for as long as it takes. And with that, I'll welcome you all. I look forward to continuing to read your comments in the chat as we go. Feel free if you have reflections. We'll go and I'll respond to you, and we'll talk to you. I'll talk to you all at the end for the Q&A. Welcome, Danièle and Kate.
Mussi, Cho, Maarsi, Alicia, Gayustis for inviting us, and to everybody that's been able to join already this morning. Thank you so much. Taanshi Kiowau, Selotsiat Nezut Nekandeta, Danièle Behn Smith Dishnakashan, Sezitla Azezon, and Michifnia P. Echodene At E, Fort Nelson First Nation Gotseate, P. Winnipeg Dostchin, Lekwungen Tanach Niwiken. So good morning, everybody. My name is Danièle Behn Smith. My Slavey name is Azezon, which means crying all the time. Through my dad, I'm a member of Fort Nelson First Nation. That's where I was born, up in the northeastern part of what we call BC. Through my mom, I'm Red River Métis, and I was raised on the banks of the Red River, right in Winnipeg. My Michif family is from southeastern Manitoba, a little town called Richer-Thibauville. I am cisgendered, straight, she, her. I'm a mom to 2 kiddos, Lucienne and Maeve, wife to Quinn, and I live on Lekwungen Tanach. That's where I'm calling in from today. And I have the great honor and privilege of serving as BC's Deputy Provincial Health Officer for Indigenous Health, and to have been working shoulder to shoulder with my good friend and colleague Kate for the last coming up on 4 years on this growing our Unlearning and Undoing work, which we're so excited to share with you today. We made a game time decision. And I'm thinking game time. The Winnipeg Jets are going to be playing this evening. I'm not a hockey fan, but I really get on the playoff bandwagon. So that just made me think of that. But we made a game time decision to do our grounding right here in the big room. Often we'll do a grounding before we go into a webinar in the green room, the virtual green room, as it were. So I'm just going to take a moment to do that. I've had the gift of being able to try and learn Southern Michif for the last few years. And so I'll be sharing a prayer from Liza Kaplan, who was from Belcourt, North Dakota. I'm still learning this one, so I'll be reading part of it. So I'll just invite everyone, if it feels good for you, to just find a comfortable position and either let your gaze fall on something that sparks joy for you, or maybe gently close your eyes. And when it's comfortable, just take a nice long inhale, feeling grateful for Grandmother Moon, Father Sky, and all of our ancestors in the stars, inviting them to be with us as we do this work together. And a nice long exhale. Sinking down and feeling again that deep gratitude to the ancestors, descendants, and medicines of the lands, waters, and territories that we're joining from. For me, that's Lekwungen. Masicho Notsini, Haichka Osiam Asiam, Maarsi, Le Bon Dieu, notre Créateur. Kichimanitu Kichiaya, Maarsi Ditwanan pour Ome la Journée. Igwa Maarsi Ditwanan pour Kakiao Limod Ota. Kishinahama Winan, Chikishkiet Tamach, Chipimetishian Kwayesh, Chinatot Tamach, Chipet Tamach, Chipamaheweach, Eishi Daweyemiach, Kitwam Maarsi Ditwanan for Kakiao Kigwe. Thank you, Creator, for this beautiful day. Thank you for all of us that are gathered here today. We ask us that you help us to learn to know you, to live life in a good way, to listen and to hear, to be of service to others in the way that you want us to. Creator, we say special prayers and blessings today for those who are hurting or suffering in any way. It may be loved ones who are so near and dear to our hearts. It may be people very, very far away. It may be our more than human relatives. Creator, for anyone that's hurting or suffering or in need of healing today, we ask that you wrap them in your warmest blanket of love, care, and protection. Again, thank you for everything. Masicho, Maarsi, Ekwshe. Thank you. Thanks, everyone, for participating in our grounding, and I will pass it to Kate to introduce herself.
Thanks so much, Danielle, and thanks, Gayustis and Alicia, for having us. We're so happy to be here. I feel the need to stand up, so here we go. I'm taking you with me. My name's Kate Jongbloed. I'm a white lady. I'm an occupier on the territory of the Musqueam people. I am right here on the banks of the mighty river. I don't know where everyone else is in BC, but many of you might be by this mighty river. I am an epidemiologist by training, and I was lucky enough to join Danièle as her sidekick during my postdoc at the Office of the Provincial Health Officer. And at that time, she asked us to bring our gaze inward about how we were showing up in relation to our Indigenous partners, and specifically the death of George Floyd and the In Plain Sight report were making it clear just how much work we had to do internally to be ready to be the best partners in health and wellness to First Nations, Métis, and Inuit people across BC. And so we've enjoyed the work and we've tried to keep it going. So now we are the co-PIs of the UNU lab, as Alicia said, the Unlearning and Undoing White Supremacy and Indigenous-Specific Racism lab for population and public health. And we say UNU because that is a mouthful. And I'm based at the BC CDC, which is under the PHSA umbrella, as you know. And when I think about our work, I think about how through the testimony of survivors of settler colonialism, we have changed as Canadians. I believe that we see, hear, and believe what has happened in the residential school system primarily, although there's very clear evidence that there are vocal resistors and deniers. But I think the majority of us are really have taken this information to heart, but moving from heart to hands is a real challenge in a system of white supremacy that is really busy holding the status quo in place. And so what we want to share today is just some of the ways that we have found really, really useful to change our thinking and to change our doing, to show up differently than we have before. And so that's what we're going to talk about today. And Danièle, is it okay if I keep going? Because I think Janessa was going to do the section. Perfect. Okay. So when we start these presentations, we have begun to do a discipline of an inherent rights acknowledgement. And so we feel it's really, really critical to recognize that First Nations or tribal or sovereign nations territory stretches to every inch of this province. Inherent rights rooted in connection to lands and territories have never been ceded or surrendered here in BC. And there are long-standing ancient systems, health and wellness systems, governance systems, legal systems that exist on these lands and territories that were here before the arrival of settlers. And as a settler person working in a settler health system, I also recognize that I have obligations to uphold these inherent rights, and that's affirmed in international law, national law, and provincial law. Also in our acknowledgement, we recognize that there are a huge diversity of Indigenous humans here in BC. There's BC First Nations people, there's Métis people, Inuit people, and First Nations from other homelands living here in BC, and they carry with them inherent rights to health and wellness. And again, those rights to health and wellness are affirmed in international, national, and provincial law. And in our acknowledgement, we've also been asked by the First Nations Health Authority to acknowledge this this truth of the ongoing toxic drug poisoning crisis. We know that life expectancy of First Nations has decreased in recent years. And this is one of the greatest threats to First Nations people in BC upholding their inherent rights and title. And this is absolutely a critical area of work for us who are operating and shaping and reshaping health and wellness systems in BC.
Mussi, Cho, Kate. I'm a bit distracted this morning because there's been a lot going on in my family and in our community last night. And so I'm just going to pause and acknowledge that FNHA released the 2024 data last week on the toxic drug poisoning crisis. And while there has been a slight slowing in the rate of deaths, it's still unacceptably high and still contributing to this staggering inequity. I just want to name that my cousin Levi was one of the 427 status First Nations people that died in 2024. He would have been 30 last year. So just want to acknowledge that. And then also just to, I've got a lot going on, like I said, in the background and with my family and community. And I'm not even really sure how much I feel comfortable sharing right now because it's my family, but we live these statistics. So I'm really grateful that everybody showed up here today. And I cannot be emphatic enough about how desperate the situation is for settlers to stand up, speak out, and do your work to untangle and dismantle white supremacy and Indigenous-specific racism, because it is quite literally killing us. So I don't often start out this strong, but just given everything that's happening right now, that's the place that I'm joining you from today. So thanks for showing up. And if you sense an edginess in my delivery, that's where it's coming from. And thank you again for all of us sharing in that grounding, because that's where a lot of my love and care was going. So thanks, Kate. We can go to the next slide. And yeah, that's my, like I told you, my traditional name is Azazon, crying all the time because I feel things quite strongly. So we are so grateful to these incredible women, Jody Wilson-Raybould, Dr. Kamara Jones, and Chastity Alphonse, and I'm going to forget the other co-author, and the BC Ministries Advisory Council on Indigenous Women for the IGBA Plus Toolkit. So when Kate and I set out to begin this work, we had no idea, truly, how one might start to dismantle systemic white supremacy. We could see that it was the root cause of so many of the harms and inequities that we wanted to be a part of correcting. And so we looked to Dr. Kamara Jones and her science and practice of anti-racism to get us started. So she names these 3 tasks: name racism, ask how it's operating in your sphere of influence, and organize and strategize to act. And so that's where we started, just in this ongoing iterative process of going around the circle time and time again, building our muscles around those tasks. Partway through the beginning of our work together, which I'll just mention that it started in the fall of 2021 when Kate joined our office as a postdoc fellow with the Health System Impact Fellowship. And Jody Wilson-Raybould published her True Reconciliation book, so excellent, and names these 3 core practices in service to true reconciliation: learn, understand, and act, which in our world seem to map really well to Dr. Kamara Jones's tasks. And so we've been progressively taking ourselves around this circle, just trying to go around and around and around, and in our incremental ways, make progress to true reconciliation. One of the insights that we've had in doing this work, if you can go to the next slide, please, Kate, is this realization that there are separate buckets of work that have different activities that need to be undertaken, and they need to be undertaken by different groups of people. And for me, this realization came about as I was trying to unpack my resistance to and dislike of the term Indigenous health. It's in my job title, and I still don't really like it, and couldn't really figure out what it was about that term that I didn't like until, through conversations, Kate and I were able to kind of recognize that Indigenous health is a term that is often used to lump together all of these different pieces of work and lump it on the shoulders often of one Indigenous person, or maybe a small team of Indigenous people that are kind of dangling off the edge of an org chart. So our work as First Nations, Inuit, and Métis people in service to true reconciliation is surviving attempted genocide and intergenerational healing and keeping our languages alive, exercising our rights and responsibilities to our more than human relatives and our lands and our waters. And it is such hard work, you guys. That's what I'm like living in this moment. It is so hard. And it is made exponentially harder by the ongoing presence of Indigenous-specific racism and systemic white supremacy in our everyday lives. On the other side of this slide, we use a copper pot. Oh, and I'll mention this is a birch bark basket that comes from Fort Liard, which is Treaty 8 territory near where I'm from. On the other side of the slide, there's a copper pot that comes from Kate's Great Opa's machine shop in Holland. And so we use that to represent the work of settlers and occupiers. And this is also hard work of seeing, naming, and then dismantling white supremacy and Indigenous-specific racism. And we were gifted a very beautiful teaching from Elder Phyllis Williams from Curve Lake First Nation, who's Anishinaabe, and she's given us permission to share this when we're talking about this slide, that in Anishinaabe culture, copper pots and copper vessels are regarded as sacred, and they're quite revered. They're used in ceremony for their cleansing and healing properties. And so when that teaching was shared with us, it really added a layer of sacredness, I think, to our understanding of this, that even though settlers have inflicted and continue to inflict so much harm through policies, practices, and approaches, there are laws, wisdom, teachings that are held in these lands that we now all occupy that can hold that work in really sacred and healing ways. So, Kate, I'm feeling, a little distracted today. So if there's anything that I've missed that we usually say on this slide, please jump in. Otherwise, I can move to the next one.
You're doing amazing, Danièle. Just the cheerleading. Thank you for your strong voice. The one thing that we talk about here is that when it comes to resources and budget, one of the things that we see can happen is when we put these 2 buckets of work in competition, basket work must be fully funded. And one of the ways that we can insidiously uphold white supremacy is when we ask that basket to share its budget with copper pot work, and that should really be coming from copper pot budgets. So that's an example of one way that we can sort of disrupt that and make sure that the basket work is absolutely fully funded and supported in different ways in our areas.
Thank you. Okay. Thanks, Kate. So when we started this work, maybe it's actually helpful just to tell kind of the beginning story, because I think, I think it actually touches on many of the people in this room. So when Kate already talked a little bit about what was happening at the time that we started this, but one of the things that was happening in the summer of 2021 is that the Cultural Safety and Humility Standard was out for public review. And so I had it on my list of things to do, and have so much respect and admiration for the team that put their brilliant minds, hearts, and hands to create that for us during the pandemic. And like doing that off the side of their desk was so amazing. And when I picked that up for review, the original title was First Nations, Métis, and Inuit Cultural Safety and Humility Standard. And I promptly put it right back down because I thought, where is the white supremacy standard? Like, how are any of my settler colleagues going to know that this document has anything to do with them when in fact it has everything to do with them? Because we do this thing of centering First Nations and Métis Inuit people both as problem and solution. And similar to those two, the basket and the copper pot, it really jumbles things and keeps things, intentionally very muddy, and it's hard to know whose work and what work. So that was how we zoomed in on, okay, this is what we want to focus on, is the white supremacy aspect of things. And then we thought about this idea that we really wanted to hone our white supremacy and racism vision, like this idea of having glasses so that we could see it, because it's often quite insidious and a bit gaslighty. And then we really wanted to make sure that we were marrying that and putting that together with actions. And so we imagine these work gloves, these reconciliation, anti-racism work gloves, because we didn't want to get stuck in a loop of learning and trainings. And we've seen that, and we've done that ourselves, gotten caught in that loop. But it was really important to us that we be action oriented. So that's essentially how this work got started. And I think I'm passing it back to Kate now.
So we are going to spend time in a learn module, an understand and an act module today. And we're going to have just like a few key concepts and ideas, building our vocabulary. Some of it might be a refresh for you, and for some of you visiting with us for the first time, it will be new. And then we'll do an activity at the end of each of these 3 modules. And I want to start by, we've been talking about 3 different kind of interconnected and reinforcing systems. We've been talking about settler colonialism, we've been talking about Indigenous-specific racism, we've been talking about white supremacy, and what Danièle was talking about just now, that sometimes in the world of health and elsewhere, we can be really, really focused on quote unquote vulnerability or marginalization, which really centers the experiences of oppression, but does not talk about the counterpoint that holds it in place. And so we appreciate Stephanie Nixon, who's provided this coin model, where she talks about each system of oppression creates unearned disadvantage for humans, but it also creates unearned advantage for others. And so when we look at it this way, the goal is not to yank people who are experiencing the disadvantage at the bottom of the coin up to the top of the coin, but rather our goal is to dismantle the coin itself, to dismantle the system of inequity. And that helps us focus on what the problem is and then what the solution is. I'm going to share now a little bit of detail about each of these concepts and how we understand them. And this one is probably familiar to many of you, but just in case there's new humans here, we use this metaphor of a net of settler colonialism. And this artwork that we use with permission from Janet Echelman, the artist, was at Canada Place in 2014. It was this giant net and projection with actually 860,000 individual knots. It weighed over 3,500 pounds. And in this way of imagining it as the net metaphor, pardon me, I think I have a coffee delivery coming. Thank you. Thank you so much. Sorry about that. I was hoping it was going to come during Danielle's slide. So with this net metaphor, there are those large lines that connect this huge net to the buildings around it. And in this way of thinking, we think about those as the major structures of settler colonialism, things like the Indian Act, the reserve system, that kind of thing. And maybe as individuals, we don't have a lot of control over those giant structures. But the net is made up of those 860,000 knots. And for us, those are the policies, the practices, the norms that shape settler colonialism in much finer detail. And so in this way of thinking, First Nations people are caught in this net, strung high above their traditional territories, which we've talked about earlier are the foundations of their laws, their cultures, their health, their wellness, their governance. And in contrast, settlers like myself, we are not caught in this net. We have actually created a segregated system of race-based laws in this country. We can use the term apartheid for that segregated system of laws. And so I am not subject to the Indian Act. I am not trapped in this net. And so from my vantage point on the seawall, or maybe from the C-suites in the buildings around it or the fancy hotel suites, the net looks different depending on where we're looking at it. So if I went in the daytime, and I did, I could barely see the net. I could see maybe only this like tiny strip of light. Maybe that's my awareness of the residential school system. It's made to look almost invisible. And then there's these moments like at night, for example, Orange Shirt Day, or maybe when the news hit of the 215 children at Kamloops Residential School, when all of a sudden the net is lit up so brightly, those of us who have arrived in the caring professions are saying, oh my God, like, what can we do? But then the media cycle shifts, our attention recedes, and maybe we can look away again. The lesson that I take from this is that one of my responsibilities as a settler person is to engage in the practice of seeing the net, of seeing which colonial knots exist within my sphere of influence, and to ensure that I keep my eyes on the net even when the tactics of white supremacy and settler supremacy try to render it invisible. So this picture too is really part of this story and about the understanding that Danièle and I have grown to have over time. And this is its installation. And so you can see in this image, just regular everyday people up there on that crane, installing and maintaining the net. That's not the artists themselves. It's not Janet Echelman, the artist. It's not Sir Duncan Campbell Scott or Sir John A. Macdonald, those men who were critical to the structure of settler colonialism. It's just regular people doing their everyday jobs inadvertently or through chosen ignorance to maintain and keep that net in place. And in this picture too, there's a couple of things I really noticed. So one is the flags there. There's the Canadian flag, There's the Union Jack. These symbolize to me the ongoing occupation of Coast Salish territory. And even if you were there at noon, you would hear the first 4 notes of O Canada, which are blasted daily at noon from Canada Place. Again, asserting Canadian dominion and occupation of unceded Coast Salish territory. The artist did not set out with the intention of like sharing this metaphor, but she inadvertently also offered a comment on how we move forward. So the net isn't solid. First Nations in BC, Métis people, Inuit people have ensured that there are many, many holes in this net. Attempts at genocide and attempts at assimilation have failed through Indigenous resistance over time. Instead, we've created this really precarious system, and we see that precarious system in health data and the disparities that we see there. So cutting the major lines all at once would create tremendous harm. And instead, how we're understanding it is that we need to work to untie enough knots that the major lines can be cut safely without harm. And so each one of us on this call participate in the health system, creating decisions, making suggestions, writing things down on paper. We likely have one or more colonial knots in our sphere of influence. And so our task is to identify those knots, with guidance from First Nations, Inuit, and Métis people, untie them. And we know that this is hard and very, very patient work, and it needs everyday attention and persistence. I'm going to pass it to Danièle to share another term that we use a lot that can raise strong feelings in many of us.
Yes, thanks, Kate. Yeah, so we've said this or used this term white supremacy, systemic white supremacy, multiple times already. And we just want to take a moment to define what it is that we mean by it when we use it, because it can be quite, it can create quite a visceral reaction for people. So this image that's on the screen right now is a painting by Kent Monkman, who's a Cree artist. And this is called The Daddies, and it's a recreation of a Robert Harris painting called The Fathers of Confederation, which up until the most recent passport renewals was actually on the second page of our passports for Canada, the original painting. When Kent Monkman saw the original painting, his attention was caught by an empty footstool in the foreground. And in his version, he's occupied that space with his alter ego, Mischief Eagle Testicle. And he saw it as a really prime opportunity to illuminate the exclusion of Indigenous peoples at this pivotal moment in history, because the original Robert Harris painting was commissioned to celebrate the Charlottetown Conference, which was one of 3 conferences that led to the Confederacy of Canada. So Kent Monkman was shining a light on the fact that we weren't included, we were actively excluded, and that was based on epistemological differences and this widely held belief at that time that Western European white ways of knowing and being were superior to Indigenous ways of knowing and being, which at that time we weren't even regarded as human, we were regarded as savage and uncivilized. And obviously, we can see from the absence of women, there was, of course, a prevailing ideology of cis heteropatriarchy as well. And so up until recently, I would, at this point, say, you know, that I feel really good in my heart to know that the vast majority of people no longer hold this belief that Western European ways of knowing and being are superior to Indigenous peoples. But sadly, there have been, you know, a number of quite vocal people in the world, politicians who are actually spreading that, continuing to spread that ideology. I still believe that it's in the minority, but it is quite loud and takes up a lot of space. That said, I do believe that most people have rejected the notion and the ideology that white folks are better than other folks. But the point that we want to make here is that this ideology really is at the bedrock of what we call Canada, and it is so deeply embedded and woven into systems and structures and policies and just the status quo, that it continues to manifest in these really gross disparities on every indicator that we count, including the indicator of leadership. So we typically think about those, health outcomes and things, but this is actually really important to think about how white supremacy gets upheld in leadership and in decision making. So when we see this and we're confronted with this, and Kate has actually updated and will be in a slide deck coming to you soon, because we've added a little white woman to BC Ministers of Health, Minister Josie Osborne, who I have tremendous respect and admiration for. And we have a new little white male head that's in our Prime Minister box, and we'll have another one come next week, or perhaps the same one, who knows. But just when we're confronted with this truth, this is a really, striking truth. In order to reconcile it, we can basically go down two paths. So we can go down the path that says, I guess there must be something inherent to white folks, predominantly white men, that does make them better suited to lead, more competent, more capable, more, behaviorally competent. But we've just said, in 2025, most of us reject that, and we are, reject that notion. So then, to make sense and be able to make meaning of this truth, of this whiteness and leadership, then we have to really peel back those and understand that coin of privilege, that there are still these deeply embedded ideologies that continue to manifest in systems and structures that confer unearned advantage on a narrow segment of the population and unearned disadvantage and functional exclusion to other segments of the population. This next slide is taken from the Population Health and Wellness Agenda that we collaborate with First Nations Health Authority on. So this is life expectancy at birth, status First Nations versus other residents. This is taken from an older one, and in the more recent one that was released last August, our life expectancy has dropped dramatically, as we spoke to in the opening, as status First Nations. And so the point of bringing this slide up is not to, show yet one other inequity or disparity that exists, but it's really to prompt us to have a moment of pause and reflection. We call this a Kendi pause in honor to Ibram X. Kendi, who has asked us to think about the fact that we may ideologically and in our core values and beliefs reject the idea of racism, reject the idea and ideologies of systemic white supremacy. And at the same time, two things can be true. We have been socialized and educated to know that this is correct, that these graphs and charts that are countless, we could pick any indicator that would show us in black and white on a graph that non-Indigenous peoples outperform Indigenous peoples. Every single one of us knows that to be correct deep in our bones, right? If we'd shown you a blank graph and asked you to plot it out, I'm sure that every single person on this call would have gotten an A+ and would have said, yeah, if I had to guess, I would guess that other residents have a longer life expectancy than status First Nations. So that's one thing that we want to pause and reflect on. The second thing is that we actually do a very harmful thing, and I've done it just now, in the way that we talk about these types of inequities and these types of data, because we say things like status First Nations have a lower life expectancy than other residents of BC. And in that phrasing, I have attributed risk to my identity as a First Nations person. And it's actually the opposite. Our identities and who we are as Dene, as Tunaha, as Tsilhqot'in, as Hulk'Aminim, that is what gives us strength and resilience. Those are protective factors. What confers risk upon us the risk exposure is being subjected to Canadian colonial practices and policies, which is undoubtedly extremely bad for your health and well-being. And I guess maybe the last thing I would just say is Ibram X. Kendi also invites us to reflect on the fact that probably the greatest benefit of white privilege is life itself, is this differential in life expectancy. I will pass it back to Kate.
So as we close this Learn section, I wanted to share that one of the practical tools that has helped us a lot with this learning stage is Unlearning Club. And this is just a model for a structured, self-directed club that we did in OPHO. We understood that a lot of this material that we're talking about is not part of curriculums in our public health programs and that kind of thing. And so we invited our colleagues to come together once a month and engage in an unlearning club. We had 70% of our colleagues join. And we are happy to talk about the Unlearning Club and how you could do it in your own team or group if you'd like. I'm also going to ask Danièle, can you put in the chat our Unlearning Club schedule? I can't see your face, so if you're nodding, amazing.
Yes, I'm going to do that.
Awesome. So we're happy to talk about that. We want to give you kind of the option of talking about which tools are the most interesting to you. So I'm going to move now into our understanding module. If I can get the slide to go. And so this is the part where we really want to interrogate, like, how are white supremacy and racism operating here? And also, what have we been asked to do differently? We start with this understanding. I think some of us, sometimes the way that Indigenous-specific anti-racism is constructed is that it's a nice to do, it's an issue, it's a moral thing. But actually, Danièle and I are doing this work not because of benevolence, not because of a moral obligation, but actually because we have responsibility under international, national, and provincial law, as we've talked about. So the obligations to uphold inherent rights, they're in the treaties, they're in our constitution, they're in multiple court cases. We have the provincial UNDRIP law, we have federal UNDRIP law. It's in mandate letters from the Ministry of Health. At PHSA, it's our North Star priority. We really, really have that obligation embedded. It's not an option anymore. We've also been given a really, really clear framework about how to do the work. The Truth and Reconciliation Commissioners shared that the UN Declaration on the Rights of Indigenous People is the framework for reconciliation. We've also received over 1,000 very specific instructions from the voices of hundreds and thousands of First Nations, Inuit, and Métis people within the TRC, within the MMIWG, 2S LGBTQIA+ calls for justice, in plain sight, etc. And so I put this here with these check marks because I think it's really, really important to say out loud and recognize the reason these 3 why, what, and hows are in place is because of the relentless work of resistance of First Nations people. For example, we wouldn't have the Truth and Reconciliation Commission if thousands of survivors had not sued Canada, taken Canada to court in what was at the time the largest class action lawsuit. It wasn't that the Canadian government did that out of benevolence. So I want to recognize all the work that has gone there. And the reason we don't have a check mark here in the last box, this is where our responsibility lies. And we have not yet stepped up to our responsibility, either as individuals. I certainly haven't. I'm working to do that on a day-to-day basis, and as a collective. So that's where our work lies. And so one of the tools that we use in the OPHO, and we've done this little survey with our colleagues 4 times now, is an action on foundational obligations self-assessment. And this is just a check-in to see how engaged are our colleagues with these foundational obligations, these really core instructions that we've been given. Why or why not might they be engaged or higher engaged or lower engaged? And what kind of strategies do they suggest about how we can do better in this area? So we do this every 6 months with our colleagues. Just to give us a snapshot, it's really minimal and it gives us a ton of information to help move to the next step. So what I want to do now is something that I find very difficult, which is technology-based. I want to invite you into this action on foundational commitment self-assessment. I'll pause here for a second and let you take a photo of this screen. I'm going to look at all of you. I'm going to put an URL in the chat. How what we call it? A URL? An URL? I got called out for calling it a GIF the other day.
It all sounds good to me, Kate.
Okay.
Let me know if there's something I can do to support just like good vibes, that it'll work.
So there's 149 of us on this call, and I'm really going to ask us to get all the way to a full number. Present. Are you able to see on my screen the outcomes now?
Not yet. It's black with a little green dot.
Black
But
with the green dot.
we did see it pop out. So we saw 3 different windows that you were choosing from, but now it's just black.
Okay. 1 minute. I'm going to share again. How about now?
Yes, now we can see it. So we're seeing, please rank
Okay.
your level of engagement with UNDRIP.
So I'm going to pause for a minute more. I just want us to get to 100. I want to have 2/3 of us. So keep going, keep voting. I can see that there's a few people on the call who are not aware. There's some people who've heard of them, a group that has read them. And then there's starting to be quite a few people who have engaged and taken action.
We've made it to 106, 107. So people are highly engaged. Thank you very much.
Thank you. And I'm going to take you to the next one. This next one is focused on the TRC. When I move to the next slide, do you guys get the new question? Yes. Oh my gosh, it's working.
It's working. It's working. Hooray. Oh, the
TRC.
Technology vibes are with us this morning so far, knock on wood.
Hey, Kate, there's just a bit of a quick question about, could you just clarify a little bit what the difference between engaged with and take action, just for voters?
Yeah, I'm actually gonna, this is a very subjective scale. This is, when we do it, we do that rank, reflect, and strategize. And the reflect gives people a chance to say why they picked which one. And I think this is sort of a moment to check in with yourself, because you're like, I feel deeply engaged, but am I moving to action? And it's that like that checkpoint, and it's different for each person. And what was interesting when we did it multiple times at OPHO was the first time round, the taken action was what it was, and then it went down the next time, because I think that people started to think a little bit more critically about what taking action meant, and were holding themselves to a higher standard. So there isn't a cut and dried definition of each one of these. It's a gut feeling. This is a gut check. It's like, where am I at right now? So this one is interesting. This is similar to what we see. TRC has been much more visible in our lives. There's fewer people that are not aware, but there are people here who are not aware of the Truth and Reconciliation Commission calls for action, and we're at the 10-year anniversary. And then there's more people who've engaged and taken action. We're at 98,
yes. I just want to pause and say, like, truly a heartfelt Mussi Cho to the 11 who have come in and said, I'm not aware of these, because I think this is like such an impediment to us doing better, is not being willing to just like be frank about where we're at. Like, that's fine, because today's a step. Now you definitely have heard of them. So next time you do this, you'll move along the row. So I just really want to raise my hands to you, because it actually takes courage to say, I don't know. And this entire effort, like this whole thing of reconciliation, is all about that deep humility and that willingness to be like, I don't know, and I want to do better, and like just kind of, that daily discipline. So thanks to those 13 now. Thank you, Mussi Cho. Okay, back to you, Kate.
So I'm going to take us now to the next one, which is asking each of you to rank your level of engagement with the MMIWG to LGBTQIA+ calls for justice. And again, we're going to shoot for 100. I didn't know that we could do thumbs up, but this is also making me feel awesome. Thanks for the thumbs up, whoever's doing the thumbs up. Oh, there's a lot.
Oh, look at them. I love them. So nice.
Friends, what we're seeing here is also very familiar.
Mm-hmm.
And it makes me so distressed. And we are the same. Like, there's no difference here. I'm wearing my earrings from Morgan Tusetta today, recognizing that May 5th is Red Dress Day. When we did this with the OPHO, the truth that we see here on this slide, the THEAT, that we have much lower engagement with the MMIWG to LGBTQIA+ calls for justice. This was a truth that we saw too. Thank you for everyone in the message who is supporting people who are having difficulty. So this was, for me, when I saw this, a wake-up call that I needed to spend a bit more time to help myself get further along. Okay, we have one more to do. I'm going to invite you for this last question to rank your level of engagement with the In Plain Sight report. And I'm going to, for the interest of time, let that trust that you will get to 100. And I'm going to move into is this right? Yeah, here. Danielle, can you see the Mentipool QR code?
No, now we're back to the black screen with the green dot. And maybe while you're sorting that, I'll just say the pattern that was emerging there for In Plain Sight, again, was quite similar and familiar to what our team, the results that our team had. And again, huge thank you to the people who are sharing that they just were not even aware of that. And for me, our team is based here on Lekwungen Tana. The Ministry of Health is at in what we call Victoria. And this report specifically was like a report about us and how we're doing. So that was one similar to Kate feeling that distress around the calls for justice. We also were like quite surprised and really curious about how is it possible? Like, what are the what is it about the practices and systems and the way that our work is structured that this really important audit of our performance in the health system is not, completely known across the board? And so that leads us into, and I think what Kate will talk about, how we responded to our findings.
So these are in a pie chart, which is different than a histogram, and that's okay. Sorry, that's my epi-human self coming out. But basically what we're going for is that the pies are all a really dark color. But you can see there was a lot of variability when we did this the first time at the OPHO, just like here in the group. It shows us that, hey, we have some work to do with our colleagues to all get on the same page about the instructions that we've been given, the life-saving solutions that we've been given to better uphold Indigenous rights. Danièle, are you going to talk about this? Do you want to, or should I talk about this?
I can. Yep, I think,
Sure.
Yep, let me talk about it. Sounds good.
Okay.
So Kate mentioned that we had a qualitative component to the survey. And so from that, we have come up with this handful of pragmatic findings about how to stop white supremacy and Indigenous-specific racism in our office. And I'm not sure if we've sort of emphasized that enough or if it's coming across enough, but this work really is about this critical self-reflection. So, and we're grateful to be able to share our work today. And it really is about us, and looking inward and being honest with ourselves and trying to ground ourselves in that humility and being able to see the areas that we've messed up, that we're messing up, and then, pursuing repair and connection and trying to do better. So what our team told us and what we learned is that when we start conversations with our grounding principles, it brings a sacredness to the work. We didn't share our guiding principles today, but we did start with a prayer. And we know that that really helps us to work in a way that kind of moves us forward with love and care. Starting conversations with our inherent rights and responsibilities as First Nations people here in what we call BC, Métis Inuit people, if we're thinking more extensively of the lands that make up Canada, is really important and effective in shifting the tone of whatever conversation comes next. Our teammates, as they started to use this language of colonial knots and this net metaphor, were finding that colonial knots are everywhere. When you start looking for them, for these little specific concrete examples of Indigenous-specific racism, of the tyranny of the majority, of whiteness in decision-making, you start to see it everywhere. We also found, as we just confirmed today, even in this Menti poll, that there's variable knowledge, and that really makes a lot of sense. And we could expect that. And so we saw that there is variable knowledge around those different foundational obligations that we all hold. We heard loud and clear, and we experience in a very embodied sense the importance of enabling leadership. So Dr. Bonnie Henry is our Provincial Health Officer. When we started this work, it was in the fall of 2021. We were just heading into the Delta wave. For me personally, and I think for a lot of us working in public health and the healthcare system, that was a point of maximal depletion. We'd already been doing how many waves? We were just on the cusp of sort of moving into, a bit more normalcy. And then we got hit by this super transmissible variant that caused, or super serious illness variant that caused, a resurgence of measures and things. So here we are picking up this really hard work. We don't know exactly how we're doing it, and we're asking our team to join us in it. And Dr. Henry is the person who stood at the front of our team and said, this work around dismantling systemic white supremacy is so important. It's core to our work. And side note, saying white supremacy makes me uncomfortable. So this is what Dr. Henry has said. And then going on to say, as a settler, I don't have a right to comfort in this work. I'm sorry, this makes me so emotional because I know all of the different weights that were being carried by by Bonnie and everybody else at that time. So she went out there and was very courageous in saying that, and then directing the team to do this work and see it as core to their work. So for the team members that chose to pick up Unlearning Club, as Kate mentioned earlier, Bonnie was very clear. She said, talk to your supervisors and figure out what you're going to put down so that you can pick up this commitment of 3 to 4 hours a month of unlearning. And so that was so critical to our team being able to really lean in authentic and meaningful and impactful ways. And I think it was Joe Gallagher who pointed out to us that we had put this finding on the middle finger, which was totally unintentional. But in our world, this is such a symbol of love and care and courage. So that's my ode to enabling leadership, and specifically to Bonnie, who's just on the other side of this wall here. Operational support. Our team and I experienced it. The benefit of having Kate with us as a postdoc fellow at that time, who had her 100% of her attention and energy going to the engine and momentum of this work, was huge. She's since moved over. The structure has shifted a bit, so now is sitting over at the BC CDC. That's where our lab is housed. And I can feel that because I no longer am sitting shoulder to shoulder. Our team feels it because we don't have that dedicated operational support. We're doing our best. We've built quite a few muscles, but definitely I can see that our progress has stalled a little bit, and in some areas we are probably backsliding. So again, saying that with like great humility, because I don't want to give the impression that we are like that we've got things perfectly going. We don't. There's still so much work that we need to do. This last pinky finding was about the team through different pieces of work that we were doing in Unlearning Undoing, really kind of stealing their desire and their awareness of the work that needed to be done. And people were showing up and saying like, yes, I want to be a part of making things right. I want to be a part of upholding the inherent rights of Indigenous peoples. I am now familiar with some of the foundational obligations. And now I'm at the point where I want and need really specific and clear guidance about how do I untie the colonial knots in my sphere of influence as an administrative assistant, as a report writer, as a data analyst. And so that pointed us in the direction of doing different types of work and tools that we'll be getting to in just a moment. Can I pass it to you, Kate? Okay.
So in response to that variable knowledge finger, the enabling leadership came in because Danièle and Bonnie were like, we see that it requires urgent attention, and within, I think, 3 months, we had a mandatory training series, essential training for all of our colleagues on the foundational obligations. We were really lucky to recruit Jordan Henry, who's at Tsimshian, a PhD student who still works with the UNU lab, and she helped develop the curriculum. And we launched, I think now we're at 7 sessions, but the initial sessions we had were first around those declaration, UNDRIP, kind of foundational obligations. Then we focused on the national obligations. Then we focused on in plain sight. And then we got together to talk about how we were going to navigate our accountability. And when we did, these were 2-hour sessions, and when we completed them and we did again our foundational obligation self-assessment, there was no longer anybody in our team who did not know about these really, really important foundational obligations. And Danièle, I think I'm going to pass to you moving into the ACT area.
Yes.
But
Yes.
I'm just going to flash this on the screen. This QR code will take you to our site that has all of our tools on it, including our outline for the foundational obligations mandatory session. We also are busy putting the mini modules of that online and creating a toolkit so that anybody else could host a foundational obligations series in their work. So stay tuned for that. We are getting our shit together slowly. It's busy. Okay, over to you, Danièle.
Yeah, and you can leave this slide up for a second, Kate.
Okay.
So we're kind of moving into this like reconciliation glove section of our time together this morning, and thinking about like really that emphasis on, so 2 questions from Jody Wilson-Raybould. Are the actions that we're taking courageous, and do they create uncomfortable change, as being barometers around, are the actions that are being taken, are they actually creating meaningful change? So that's something that we keep in the back of our minds always. And then also, we've just once again gone back to Ibram X. Kendi's teachings in How to Be an Anti-Racist. And one of the things that really resonated so deeply with me this month from Unlearning Club was the idea that this is really a binary. So there are racist behaviors and there are anti-racist behaviors. They're not core identities or moral failings. It's actually about, are you in any given moment, either through your actions or inactions, upholding racist policies and approaches, or are you actively resisting and trying to dismantle them? And he talks about those being more like a peelable name tag, racist, anti-racist, versus a tattoo. So I think our actions and what you're seeing up on the screen are tools that we're creating to help us to more consistently and in a more consistent, conscious, coherent way, again, words from JWR, be wearing our anti-racist name badges. So going to the next slide, one of the tools that emerged early on was something we call this colonial knot review. And this started, one of the things that I didn't say actually earlier when the basket and the copper pot were up, I did mention that one of the problems with that is that, it often puts all this jumble of work and rests on the shoulders of Indigenous peoples. But one of the ways in which it does that is it doesn't provide a very clear entry point for settlers who want to engage in this work to get in there. So I know many settlers who, when the work is labeled Indigenous Health, they have, rightly so, questions about, is this the right space for me? Am I taking up space that should be held by Indigenous peoples? So I think having that clearer understanding of, yes, like get in there and do the heavy lifting of copper pot work, and make sure that you're resourcing equitably the basket work that needs to happen and supporting your Indigenous colleagues in that way is important. The reason that I bring that up here is because part of how this tool came about was, I think, that lack of understanding of these different buckets of work that exist. And so a pattern that was so frequent when Kate joined the office back in 2021 is that I would have colleagues who, in where they were at in their journey and spectrum of understanding of these different foundational obligations, knew that it was important to include Indigenous perspectives, but beyond that, didn't really know what to do. And so I would often get asked to review documents, policies, terms of reference, reports. And our friend Jessie Dame experienced this as well, a Two-Spirit Métis nurse and clinical educator. And he would call it the request for a dream catcher stamp. Like, people felt like, oh, okay, well, if I get some Indigenous eyes on this, then I can say, yep, I've done my due diligence. And Kate could see, like, for me, it was just a total heart sink, because then I would start reading through these documents and realize that beyond the idea of like, oh, we should send this to Danièle, there had been zero reflection on Indigenous inherent rights and jurisdiction, zero reflection on or inquiry or curiosity about the foundational obligations that related to the particular topic of whatever document it might be, and then no reflection in terms of the ways in which institutional racism were showing up in that document. And so we just together talk through, okay, what are the patterns of the things that are creating this harm alarm in me? Because again, it was like a real embodied sensation, and then we responded by creating a bit of a checklist to help us respond to these requests. And so on the next slide, you'll see some of the patterns that showed up, or some of the elements of the colonial knot tool. And I think we're going to move into an activity just in a moment where you might actually be able to play with this. But the first element is that it starts with a self-location and positionality. So it's really important that we start every interaction, every piece of work that we're doing, with that grounding about who we are, where we come from, and what is our specific orientation to, as we're saying in this particular presentation, settler colonialism, systems of white supremacy and Indigenous-specific racism. Then we have this element of recognizing inherent rights. And again, this is so place-based. In any given moment, if you're operating and working in what we call BC, you are operating on the lands of a nation that's been here for millennia, that has its own laws, its own systems of governance, its own jurisdiction, and those are largely made invisible in day-to-day settler life policy practices. But make no mistake, wherever you're sitting right now, there's an additional system of laws and jurisdictions that are at play, that are valid, that exist, that you may or may not be aware of. Third is foundational obligations, which we've talked about a ton. So just doing a quick check. And one of the things we developed that's been so helpful, and it's so simple, really, is an Excel sheet that actually holds all of the different foundational obligations that are listed in those reports. So we can actually just quickly go in and search for homelessness, search for substance use, search for climate emergencies, to see quickly and readily what have First Nations, Métis, and Inuit people already told us to do in relation to that topic that we're reflecting on. Indigenous-specific racism, again, I mentioned, is the tyranny of the majority at play. Are you including Western evidence and excluding Indigenous evidence? There's a few prompts. And then finally, considering intersections. Jeremy Dutcher has a really beautiful way of describing the fact that to live at the intersections of multiple systems of oppression is incredibly dangerous. So we're trying to build our muscles around thinking intersectionally around sex and gender and ableism, amongst other systems. I think I am passing it to Kate next. Perfect.
So Fiona has shared the Colonial Knot Review tool in the chat, which I really appreciate. And we use it not as a comprehensive tool that if you go through it, you can check off and say, yep, I am 100% woke. It's more just a list of questions that help us get started in strengthening and disrupting the status quo. And this is a much faster but also related tool. I'm going to invite you to open up a document that you've been working on this week. Maybe it is a project charter or a communications email, that kind of thing. I'm going to look at your faces because, oh, I can't see your faces. But maybe once you've got something open, it doesn't matter what it is, you could just throw your hand up. And once I see a few hands, I will invite you to this next step.
People are doing that and opening the documents. I just want to go back and share a quick story about that thinking intersectionally, and again, modeling maybe some of that humility. So I mentioned in my introduction, I'm cisgendered, straight, she, her. Guys, it's taken me 3 years and countless generous, patient teachings from my so my Two-Spirit Indigenous queer relatives, to incorporate that on a pretty consistent and disciplined basis, this idea of self-location and my positionality to that particular system of oppression. We were at a Healing Our Spirit Worldwide conference in Vancouver, a conference with thousands of people. This was a couple of falls ago. And we presented a deck very similar to this, including the deck with those, the check marks that Kate had and those columns. And we were feeling pretty good about sharing the work that we were doing, this international conference. And then Sylvia Miracle, who's like an incredible Two-Spirit matriarch, stood up and just basically like really called us out in front of this highly esteemed audience to say, you are upholding the erasure of Two-Spirit LGBTQIA+ peoples. And she was so correct, because on that slide at that time, we were using the acronym MMIWG without the Two-Spirit LGBTQIA+. And it was so painful and so embarrassing, and so correct. So we did this, we Control F'd MMIWG. I actually found it somewhere in our stuff just this week where we are still doing it. But Auntie Albert McLeod was there as well, and as is our way, as many different nations, was incredibly gracious and loving and caring, and afterwards kind of came and gave me this, it wasn't this exact flag, but a Two-Spirit flag that they had. And so that has been this artifact that I've tried to use to strengthen my muscles of seeing this unearned advantage and privilege that I walk through the world with. And so I just wanted to share that, because like truly it's taken, I can't remember if that was 2 or 3 years ago, but it's taken a long time, and I'm still like, my cis hetero privilege shows often still, and my two sick relatives have to be like, oh, by the way, my cousin gave
You're
me
doing
the
it
sweetest
again.
little pin, that said like, I'm trying. I really am trying. Okay, sorry. So hopefully I bought people some time to open a document and maybe do a bit of Control F yourselves.
So Nicole has her document open. Thank you, Nicole. So I'm speaking directly to Nicole, but we invite you to try this tool where you press Command F or Control F and search these terms here on the side. And is there one human who would be brave enough in the chat to say what you found, or come off silent and say what you found? Nicole found 5 instances of Indigenous. Awesome. Did you see anything about the foundational obligations, Nicole? Siobhan, nothing. I appreciate these comments. This is our experience as well with when I do a Command F on something I wrote 3 weeks ago, I always find something that I'm unsatisfied with. I think, Danièle, at risk of taking a story from you, one of the reasons that we started doing this approach was Danièle received a slide deck that was a really important. Do you want to tell this story, Danièle?
Sure, because it's so
okay.
funny.
Yeah.
But not. It's actually horrifying. But the Public Health Agency of Canada was presenting a slide deck on sort of like post-COVID, building back better. And I think I wasn't in the actual meeting, and so I was just looking at the slide deck, and I don't know, it was like 20 slides or something. And so I went through, and I thought, oh, I must have missed it because this was 2023 or 2024. I was like, because certainly in like whatever year it is, it might have even been 2022, it's impossible that the Public Health Agency of Canada could put together a slide deck and not include Indigenous anything. Like that's just outside of the realm of possibility in this, current time and climate. So I did that. That was my very first Control F, and I had missed it. It was on the second to last slide, and we were included in the second to last bullet, under like lumped in with many other marginalized and vulnerable groups. And I was so disappointed, and then went to my team. Yes, thank you, steam billowing out the ears to be like, can you believe this? But then the gift was that it really shed a light on us that, oh, this can actually be a very helpful tool, Control F, and looking to do better. And as Kate says, we use it on our documents all the time, and we always find areas that we're lacking or missing and can do better. And maybe I'll just like quickly say, and then we're almost at the closing, and we'd love to hear from you guys as well. This idea of discomfort, like Bonnie said earlier, like I don't have a right to comfort in this work. And actually, we all collectively need to be uncomfortable. That's what Jody Wilson-Raybould is asking us too. Like, are we creating uncomfortable change? And I have a parenting group community that I'm part of, Good Inside, led by a white lady in New York City, Dr. Becky Kennedy. And one of her teachings applies so perfectly here in my estimation, because she talks about discomfort signaling to us something is unfamiliar and we're doing something new. It doesn't need to signal that we're doing something wrong. So in the context of this advancing true reconciliation, in the context of eradicating Indigenous-specific racism and systemic white supremacy, we should actively seek out moments where we are uncomfortable, because it's signaling to us that we are then starting to tread down this less familiar road, this bumpier, messy road of reconciliation, but it means that it's actually getting us towards the destination we want to go, rather than staying on these well-worn, entrenched, familiar paths that keep this colonial net so firmly in place and actively causing harm to today. I'm feeling it to my loved ones. Okay. Passing it back to you, Kate, to talk about these patterns.
So this slide grows every time we share it. And these were the patterns that we started to notice in our own documents, in documents that others had asked us to review. In some moments, there was nothing. First Nations rights and title or Indigenous rights are fully invisible. Sometimes the problem was mislabeled, so that what Danièle was sharing, that chart earlier, when we say we construct indigeneity as the risk factor rather than being subject to settler colonialism. Sometimes, like in the FAC slide deck, there's like a paternalization or a stereotyping, putting First Nations people into a vulnerable group category rather than a rights holders category. Sometimes colonial scripts are upheld. Maybe there's a very strong preamble, but then there are things later on in the document that actually work against the fully realized inherent rights of Indigenous people. Sometimes there is a pan-indigenization that happens. The distinct, unique rights of First Nations, Inuit, and Métis people are not recognized. And sometimes there's an EDI blanket that's applied, and Indigenous rights holders are conflated with equity-seeking groups. So these are patterns that we see, and they are patterns that we can really disrupt just through concerted everyday action. And as Danièle says, we are trying to disrupt these patterns. Pan-indigenized, Gareth, we know that BC is home to First Nations people from over 30 language groups, 200 different bands under the Indian Act. So there's a huge diversity here. We know that one of the tactics of settler colonialism is just to pretend that all Indigenous people are the same, when that's not true. And so what I'll do is I'll share the distinctions-based primer in the chat in a second, or somebody, well, Fiona's really good at sharing links. Fiona, can you put the distinctions-based primer? Yeah, awesome. And so that's, we have tools that can help us deepen our understanding of that one too. It's a great question. So I'm going to move now to our closing. And I want to say again, moving back to those guiding frameworks and those tools that are there at our disposal. This is again from Jody Wilson-Raybould, her book, True Reconciliation. And she reminds us that the thing that we're being asked to do is not to fix First Nations, but to fix ourselves. She says, and so one of the things I make sure non-Indigenous people understand is we don't need you to help heal us. We need you to fix yourselves. We need you to get those people out there who are perpetrating this process of working against reconciliation under control. And I can say absolutely that I'm one of those perpetrators inadvertently, but unless I stay disciplined to it, I am busy with settler colonialism. I need to override my programming all the time. We need you to straighten yourselves out. We don't need you to just step forward and say, well, here's what we can do for you. Because my question is always, what are you doing for yourself? What are you doing to get rid of that violent vocal force that is holding us back, holding all of us back, holding this country back? Because that's what's going to stop reconciliation. And Danièle shared this at the beginning, but we use this over and, oh yeah, go.
I was just going to jump in. Just before, because this is a big ask. It's like this requires so much courage. I'm thinking of, again, because of what's happening right now in social discourse and media discourse, you know, there's these countless opportunities for settlers to stand up and speak out against other settlers. So I guess I'm just thinking again, in this slide, thinking about the basket work and the copper pot work. And an example, I have an Indigenous physician colleague who reached out to the College of Physicians and Surgeons to raise concerns about recently a physician who had amplified through social media settler denialism related to Aaron Gunn. And so the Indigenous physician reached out to the college to be like, wanting to know if you're aware about this and just wanting to know what you're doing about it. And the college's response was very disappointing in that the response was, well, we can't speak and share whether a complaint has happened or not. But if you would like to lodge a complaint, here's the process. We are so freaking busy, you guys, just trying to survive, literally trying to survive. There are, in BC, First Nations physicians make up 0.4% of the roughly 15,000 registrants. And so the college has the audacity to ask one of our 0.4% to take on this responsibility. Where are the other 99.6% who should be absolutely standing up and speaking out when one of their colleagues is perpetrating harm? So I wanted to share that because you have responsibilities and you have power and you have the privilege of not carrying the weight of these statistics in the way that we do. So use it. And I'm so edgy today. I'm fired up, but we didn't share our guiding principles. The previous slide had all of these beautiful quilt patches. Kate is a quilter. She made us matching sweatshirts. I didn't wear mine today because I forgot, but partially I also want to keep it clean because we're going to a national conference next week. So I want to show up and represent as a team, you and you. But we have a grounding guiding principle of love and care. And so I just want you to know, like, truly it was in the prayer, and I extend it to myself, to everybody on the call today, that we are wrapped in a blanket of love and care to do this work, because it is freaking hard. There is no two ways about it. There is no easy road to reconciliation. So I just really wanted to say it like in tandem with Jody's words, because she's edgy too. And she's like really asking you to do a super hard thing. Okay, thanks, Kate.
We're doing this super hard thing, and when in doubt, we return to Jody. She gives us the path to walk. We return often when we're stuck. This is how we get unstuck. We ask, what homework have I and my team done to learn from the original inhabitants of these lands and waters about their laws and teachings, as well as the truths of settler colonial harm and how they continue to manifest in the present day? What homework have I and my team done to understand what must be done in our sphere of obligations to meet the foundational instructions and obligations that we've been given? Act. How have I and my team begun to act in ways that challenge, elevate, and advance true reconciliation, including hardwiring in accountability? And Jody talks about it being a marathon, not a sprint, towards meeting these foundational obligations. And so we're getting really close to question moment, but I do want to do this last activity where I'm just going to give each of you 1 minute to just jot down one action that you're going to do this week, this week and next week, to incorporate what we've shared today into your tools and projects. So starting now, we'll just give you 1 minute. So option to share it in the chat if you'd like. I always like to know, because people come up with different ideas than the ones I have, and then I can integrate them into my own day. So I would love to see it, but not a requirement. We're going to share one last metaphor with you, and then we'll move to a Q&A. Danièle, do you want to share this? I'm
Sure.
out of words. Okay.
Sure. Yeah. If it hasn't come across yet, we love a metaphor, guys. We really do. So one of the ways that we've thought about the work that we're undertaking is that it feels very similar to going to the gym and building muscles. And when you've kind of either never been a person that's done that, or you're getting back into a routine after a long time of not doing it, it can be really tough, and it can be daunting and intimidating. And, in those earliest days, it can be so helpful to have a very scripted program, or have a coach that's right there correcting your form and telling you what to do next. And often you start it and you're feeling like really energized and motivated and thinking like, yeah, this is the year, I'm going to do it. And then you go maybe once or twice. And then for that third workout to show up, you're sore, the lactic acid has built up, and your motivation has, fallen. Your, life is happening. So all kinds of things are blowing up in your world. And like the last thing you want to do is go to the gym. And yet, the way that you make progress and develop strength and stamina is through the discipline of showing up, even when you don't want to, even when it's really hard, and even when there's, competing interests in your world. it becomes part of your identity, right? Like you're a person who, in the same way that maybe you're a person who doesn't steal or cheat, you're a person who doesn't miss a workout. And so I think that's what we're encouraging people to do, is kind of find a program, stick with it in a disciplined way, show up even when you don't want to, create those accountability mechanisms with the people around you so that they can check in and say, how's that going? Did you make it to the gym today? And just support one another, because we can see it and we can feel it in the fact that we, you know, have, as I say, feel like we've built some muscles. And I'm really going to emphasize it, we have so much work to do. So we are not out there on the beach with like beach bods and six-pack abs. Like we are still really ourselves deep in it, and we experience it the same way that everybody else does. And so hopefully we're just kind of growing our community of folks that are building their muscles around eradicating Indigenous-specific racism and dismantling systemic white supremacy. So Mussi Cho, Maarsi, Haichka, or Haitsepka, everybody for joining. We really appreciate it. As I say, for me, that comes from like a deeply, deeply personal place. If me and my loved ones and family and extended relatives, if we could fix settler colonialism and undo it, we would like devote ourselves to that 100% of the time. But it's not our problem to fix, but it absolutely causes us great harm and suffering. So I really raise my hands to everybody that's here today, because we're counting on you. Mussi.
Wow,
Thank
Gaelic
you.
Kisla for that. I'm really going to attempt to stay away from the fitness metaphor. As you can see, I'm on 90 minutes. I've got a glow. I want to be better at ISAR. I want to make a stand, but I'm also going to stay healthy. And if you want to experience resilience, hit a core plank. It's not going to feel like a positive resilience. Time is going to slow down. It's going to be difficult. Oh no, I'm sharing into the metaphor, all right. Sometimes you don't feel like it. Lactic acid is a lie. It's a pH imbalance in the muscle that sends a signal through your central nervous system indicating that something's wrong. Nothing's wrong. You got to shake it out. You got to get loose, stretch, do a different thing. And I think in this work, talking about how it doesn't end, the smartest thing is to adapt. And I just wanted to thank you. I got to figure out how to say crying all the time in Kwakwala. I think I might nickname myself because Gaelic Kisla for bringing your heart and your mind into this work. I think we'll take a couple of minutes. We've got 15 minutes of questions. And yeah, but I just wanted to raise my hands to you. And thank you everybody who has been brave and stepped into the space. I realized I didn't introduce myself. I'm a facilitator on the ISAR team here in PHSA. So Alicia, Fiona, do you guys want to field some questions?
Sure. Thanks, Gayustis. And thank you so much, Danièle and Kate. I think as you saw with the questions you put forward, Danièle, you said that we have a high level of engagement, and completely true. So I've invited everyone to go ahead and pop some comments into the Q&A. And the Q&A and the chat, they're kind of different columns here. You can only see one at a time. And for everyone, if you don't have a question, you can go on and vote for the one you like best. So I just want to, we've got some technical questions and people asking for links. So you'll see them they've been posting the Q&A, the links to your Colonial Knots tool. But I wanted to start us off just with a question about budgets. And I'm going to maybe start with some of the questions that were asked earlier on. You know, at PHSA, we're in this really interesting time. I think the whole government is an interesting time with a lot of real budget constraints, economic strains, and we're seeing a lot of battles being played out there. And just hearing your call to invest more and invest in both the cedar basket work and the copper pot work. And I really loved how when you mentioned some of your tools, you talked about tools that actually don't cost anything at all, you know, like grounding before, all of the tools that you shared, looking at UNDRIP. These are all things that we can take action on that don't require any money. But I do want to ask you a question around money. And there were some comments also around, so how do we redirect our funds? How do we deal with funds in the face of all this? even reprioritization. This is something that we've seen come up at PHSA. So I'm just wondering, do you have any, or do you know of any tools, or do you have any suggestions to support people as they're dealing with budget issues in relation to addressing Indigenous-specific racism and white supremacy?
I have some thoughts that I can maybe start with, and then Kate, please feel free to jump in. We always go back to those frameworks. And so I think for me, it's really helpful to look at whatever given, new budget direction is, or policy that's coming out related to, and we're for sure experiencing that here in government, and reflect on naming the ways that racism is showing up in that policy or that direction. Because once we see it, then we can get a better understanding of how it's operating, and then we can respond and find ways to make the policies anti-racist, and make the fiscal distributions anti-racist, or the restrictions anti-racist. So a really prime example that I'm thinking of that we're grappling with on our side right now is government is in a temporary hiring pause. And I know that at the Central Public Service Agency, they're grappling with the fact that that direction is directly in tension with in plain sight recommendations to increase the number of Indigenous senior health leaders. And so they're needing to find ways, even in this restricted fiscal climate, to make sure that there's a mitigation of that deeply entrenched white supremacy in retention and recruitment, right? Because if you just close the door and say, okay, for right now, nobody else is getting into government, well, you're just holding this steady state of inequity in terms of who's actually already in the door. So that's one of the ways, and the ways that I think about it is going back to that, okay, this is the direction that's coming, or the direction that's being discussed. Let's really think through critically, who does this direction advantage and who does this direction disadvantage, and make sure that it is also thinking about the supremacy of First Nations rights and title, because we operate on these on this collection of territories. Kate, if you have other thoughts on that.
One of the other things I was thinking about from this question is one of the tactics that we use is a cashback policy. So any money that comes into the UNU lab that we are spending, we do our best to spend that money with BC First Nations vendors. So whether that's hiring BC First Nations people, whether that's like when we host an event, we spend our money there. Yeah, those are the things we spend most of our money on. And if we can't do that, then we extend wider, recognizing that settler vendors, and especially white vendors, have been privileged through all of PHSA's history. We can flip that. And so, yeah, a cashback protocol, a procurement policy for us works for the UNU lab, and that's one tactic that we use. Cashback is related to the concept of land back, and I can share in the chat a couple of resources there.
Thanks so much to both of you. We have a few more questions. I'm going to try to lump some of them in together. We have some questions about DEI work, so diversity, equity, inclusion work, or equity-seeking groups, and the work around Indigenous-specific anti-racism. And some are saying how they can often get conflated between the two, and this can be confusing for people in the workplace. So there's a request for just some thoughts, some clarification around it. So how are they separate? What is the need to keep them separate? If you could comment on that, would be really helpful.
So again, I guess I'll start and say, I don't like the language of DEI. I think that this is yet another way and a settler tactic of masking the true roots of why that's even required. So I prefer to talk about racism and systemic white supremacy and really focus on those root causes as the mechanisms that that we need to address and eradicate, as opposed to just this idea of diversity, equity, inclusion. I will, when Kate responds, I will try and find a definition that I really like from Regina Jackson and Syra Rao in their book, White Women, Everything You Already Know About Your Own Racism and How to Do Better, because I think they really encapsulate it well. I think the main issue and why we've identified that as a pattern that upholds Indigenous-specific racism is that when you lump equity-seeking groups together, again, it erases the distinct inherent rights that we have as the original inhabitants of this place. And that is highly problematic because it also erases our jurisdiction. It erases our responsibilities and our connections and relationships to these lands and waters, which are different from people who are not the original inhabitants of this place. So it's not to minimize or dismiss the harms that are inflicted and experienced by people that live at the intersections or live at other intersections of systems of oppression, but it is to really name specifically that there are legal obligations to have nation-to-nation relationships between the Crown and the nations that were here at the time of contact that are upheld in international, national, provincial laws. So for me, that's the distinction. We've heard people talk about, not wanting to get into an oppression Olympics, because then again, it conflates all of this different work. All the work is important. And that doesn't mean that any of us are, what's the word? Like that any of us don't have specific distinct responsibilities to the nations whose lands we occupy. So coming from a place-based place. I'll try and find the definition if, Kate, you have other things to say.
Yeah, I have two thoughts. One is an agreement with Danièle that like the DEI, for me, that language, again, doesn't focus on the system of oppression that we're trying to dismantle. And so one of the things that came up for me recently is like the opposite of diversity is dominance. And so when we talk about white supremacy and we talk about that infographic with the text messages and the white faces, that reflects dominance. And so that is the thing that we're working against. And the outcome will be diversity, but let's focus our attention on the problem. The problem is not diversity. The problem is dominance. So for me, that's one of the reasons, in addition to what Danièle has said about the really critical importance of being place-based in our analysis. And the other thing I wanted to go back to is the basket and the copper pot. We know that when we lump basket work and copper pot work together, it can siphon money away from Indigenous health into anti-racism. And I think, again, when we lump DEI work, which is so important, in together, again, we're like smallening the amount of resources that we invest. And so smallening, definitely a technical word.
And I know you've got other questions, Alicia. I just want to add another humbling teaching moment. So I'm telling you all these things that we do where we get it wrong. But another problem with, even with talking about anti-racism, and we've done this a few times over the last year, where we have extended our reach sort of beyond our wingspan. So we have people on our team with lived experience of Indigenous-specific racism, but up until recently, we did not have people on our core team with lived experience of anti-Black racism. It is same but different. And so by lumping everybody together, you actually, again, mask and create this assimilation And then you can't really get to a finer, detailed understanding of these different systems of oppression and how they are experienced and how they manifest, so that you can untie them. So that's just another area. We try and be as specific as we can in our language, and I just find DEI is unhelpful because it perpetuates kind of that lumping together.
Thanks so much to both of you. So I want to end with some kind of technical questions about your work. And there's a question in the chat. I'm not going to ask it to you because it's very complex and we don't have time to go through it. But just around lumping people together in the question of identity. And maybe this is a question I'll just ask everyone. So this isn't to Kate and Danièle, but I'm just throwing the question back out to you. People are talking about, some people have suggested the in plain sight and talking about the identity, controversy around the identity of the authors, and trying to wrestle with this. And I just want to put the question back out to everybody else, just to think about when you're engaging with this work, what is meaningful to you, and what do you think? And you've taken a look at in plain sight report, and you've seen the work that's there, and even just thinking about this question of what is the goal and what is the end goal, and what are we working towards? So I just want to throw that back out to everyone. But what I would love to end on with you and Danièle, with Danièle and Kate, sorry, I was looking at Kate when I said it, are some technical questions. So it's clear people want more and they want to share also amongst each other. So they would like to know, one, can you please share your deck, or is that possible? Number two, is there a place where we can share the actions that we're doing? And number three, several people are interested in the Unlearning Club, and they're asking, is there a way we can do it together or support for us doing it together? So I'll leave you with those three questions on how we can continue to share the work. And then after you're finished, I'll just invite Gayustis to take it away and to bring us home with a nice close. Thank you.
Kate, can you field those?
Yeah, so we got a small amount of money from Health Research BC to create a workshop series sharing our tools. And we are creating workshops specifically related to the Colonial Knot review tool, how to host an Unlearning Club, how to do the assessment, training, and accountability to the foundational obligations. Those are the three we're starting with. And we expect those workshops to be available at any time. No, not any time, by the end of the summer. Yeah, so we will be able to post those on our YouTube channel, guys. And anybody can do an Unlearning Club. It's just a list of books. And Jeanette, I owe you an email. I'm sorry you had to ask this question in this forum. I owe you an email.
Oh, Gaelic is that. It's just always a pleasure to share space. I wanted to just thank you again from our ISAR team and our learning series, Gaelic Isla, so much for these practical applications in the work, that our departments are allies. We often overlap. We share the same spirit. Latsamat, we also share the same mindset. And I just wanted to also lift my hands to the 47 leaders at PHSA that are making up 25% of the Mooside campaign champions. I want to lift my hands up to HABC, who's been taking on learning with us. And I'd like to invite you all to attend the Indigenous Health Town Hall and hear what our fearless leader, Joe Gallagher, has to say about this work and how it applies to us. And also register for Len Pierre webinar, which is the next learning series, which covers psychological safety. Gaelic Kisla, so much for everybody for taking the time to make time for this work, because that really is the first step. And with that, I'm going to continue walking into my next meeting, which just started. So thank you. Do you anybody else from my team have closing thoughts? No? Okay. Thank you so much. Just
Maarsi, Maarsi, Haitsapka, Kawapamitanawao.